Ischemic preconditioning is mediated by 1. ATP sensitive potassium channel K-ATP, 2. Sodium channel, 3. IKR, the rapid component of delayed rectifier potassium current, 4. L-type calcium channel. Correct answer 1. ATP sensitive potassium channel. Blockers of ATP sensitive potassium channel like glibenclamide can prevent ischemic reconditioning. K-ATP channel opener nicorandil can mimic ischemic preconditioning and it is known as pharmacological preconditioning. Stimulation of adenosine receptors is known to simulate ischemic preconditioning. First percutaneous intervention for a regurgitant lesion in humans was for 1. Aortic regurgitation, 2. Mitral regurgitation, 3. Pulmonary regurgitation, 4. Tricuspid regurgitation. Correct answer 4. Pulmonary regurgitation. Bonhoeffer and colleagues described the development of a system for percutaneous stent implantation combined with valve replacement for right ventricle to pulmonary artery prosthetic conduit with valve dysfunction in 2000. Which of the following is not a feature of pulmonary hypertension on pulmonary valve M-mode echocardiogram? 1. Flat EF slope, 2. Shallow A wave, 3. Deep A wave, 4. Mid-systolic notch. Correct answer 3. Deep A wave. Deep A wave is seen in pulmonary stenosis. All other features are of pulmonary hypertension on M-mode echocardiogram. Pulmonary valve M-mode echocardiogram in pulmonary hypertension showing flat EF slope and a shallow A wave. Feature of mitral stenosis on M-mode echocardiogram. 1. Flat EF slope, 2. Absent A wave, 3. Paradoxical anterior movement of posterior mitral leaflet, 4. All of the above. Correct answer 4. All of the above. Here is an M-mode echocardiogram in severe mitral stenosis with flat EF slope, absent A wave and paradoxical anterior movement of posterior leaflet. Another M-mode echocardiogram showing reduced EF slope, absent A wave and paradoxical anterior movement of posterior mitral leaflet in mitral stenosis. Which coronary vein is important in the genesis of atrial fibrillation? 1. Great cardiac vein, 2. Oblique vein of Marshall, 3. Middle cardiac vein, 4. Small cardiac vein. Correct answer 2. Oblique vein of Marshall. Oblique vein of Marshall, also known as oblique vein of left atrium, can give rise to atrial fibrillation. 3 reasons described are the myocardial extensions into the structure, node-like remnants within the vein, and the rich autonomic innervation surrounding it. Valve at the ostium of coronary sinus is known as 1. Thebesian valve, 2. Vuessen's valve, 3. Eustachian valve, 4. None of the above. Correct answer 1. Thebesian valve. Valve at the ostium of the posterolateral vein at the junction of the great cardiac vein and coronary sinus is called Vuessen's valve. Eustachian valve is at the ostium of the inferior vena cava, which directs blood to the foramen veil in fetal life. Greatest sensitivity for ST elevation in right ventricular infarction is for ST elevation in 1. V1, 2. V2, 3. V3R, 4. V4R. Correct answer 4. V4R. ST elevation of 1 mm or more in V4R had the greatest sensitivity of 93% and predictive accuracy of 93% for right ventricular myocardial infarction. Which of the following is not a usual clinical finding in right ventricular infarction? 1. Elevated jugular venous pressure, 2. Positive Kussmaul's sign, 3. Hypotension, 4. Basal crepitation. Correct answer 4. Basal crepitation. Lung fields are usually clear in right ventricular infarction despite elevated jugular venous pressure. This is because the pulmonary capillary pressure is usually low due to reduced right ventricular output and left ventricular preload.